Many of you know Dr. Douglas B. Evans because he has treated you, or he's treated somebody you love. Yeah. The professor and chair of the Department of Surgery at the Medical College of Wisconsin and one of the nation's preeminent pancreatic cancer surgeons and researchers. Dr. Evans is known for developing groundbreaking treatment methods, performing complex surgeries, and treating patients with tumors that others have deemed inoperable. Dr. Evans is both an undeniable leader in pancreatic cancer care, and he's also a heck of a human being. Now, I'd like you all to listen very closely to Dr. Evans because the funds that are raised here tonight will stay right here in Milwaukee, where they will help finance a clinical trial at MCW that Dr. Evans is going to oversee. So please, let's give a warm welcome to tonight's keynote speaker, Dr. Doug Evans.
Thank you. Yeah, thanks a lot. Yeah, thank you very much, Josh. It's amazing to be here. When I started in this business a long time ago, I never dreamed that we would have an evening like tonight. Before I talk about all of you and the Sina Mangowitz Foundation, the Brewers, and the two Rogers. You know, a quick shout out to people who have supported the Department of Surgery for a long, long time. Bud and Sue, Bob and Judy, Joel and Arlene, Melissa and John. You know, thank you all so much. Thank you. And I'd also like, I think some of you may not know Gustavo Leone, director of the Cancer Center. Gustavo, can you raise your hand over there? And next to Gustavo is Eric Conley, president of Froedtert Hospital. So, you know, all of the Froedtert Hospital crew, you want to get to Eric while he's had a couple glasses of wine, okay? Everyone who works at Froedtert and MCW, can you raise your hands just so we can? Really great. Thank you all so much. Thank you all so much for coming. Really fantastic support. And for those of you who have been looking out into right field, you notice that there's a pancreas cancer awareness flag up there. And I think, where's Wendy? Wendy and Roger put that together. I can't see where Wendy is, but Wendy and Roger put that together a few years ago, right? And it's really, and the Brewers fly that more often than not, which is really, really fantastic. So with that, I'm going to hopefully be able to change the slides here. So I'm going to talk about being in the arena, and I did this last year a little bit, showed a couple of videos, and Roger Mangowitz said, you have to bring some videos back. So what I'm going to try to do is bring all of you who haven't been in the chemotherapy unit, been in the operating room, give you a flavor for what all of the patients in this room go through. The arena was coined by President Roosevelt many years ago in a famous speech in Paris when he talked about the importance of being in touch with the men and women who were actually doing battle and dealing with this day in and day out. And so I added to being still in the arena the importance of a hope and a plan. And I think you heard from our previous speakers, Erkut and Dan, the importance of a plan and how the plan is being developed. I had a lot of help especially with the videos, with the slides. I'd like to thank Gabby, Natalie, Wendy, Haley, Susan, and Melissa very much. So I can't remember whether the owners of these two tattoos are here tonight, but I know they're both doing well, and this is something that's great about pancreatic cancer survivorship and really great about Wisconsin. I can't show you my tattoo right now, but you know, maybe later. Huge thank you to the Laban Pancreatic Cancer Program, to Susan Tsai, who has put all this together. And a big shout out to Marianne and Pete Laban, who have endowed our program. Just tremendous work. Roger, I'm going to talk about you in a moment, but this is just fantastic. So this is where the plan, and remember I'm going to spend a couple minutes on hope and a plan. So this is where plans are developed, and I think we're so lucky looking forward in the next few years because we have just really smart people developing the plans for all of the future patients with pancreas cancer that may be unfortunate enough to have this disease. And this is where hope lives. Our patients of today, all of you, this is going to be an old slide as of tomorrow once I get those pictures from this morning and this afternoon when we had all of the pancreatic cancer patients. Along with the H of hope, I would put the H of heart. I think we talked a little bit about Ron Brefka last night. Here Ron is pictured with Gabby on the front page of the American Motorcyclist. I always associated Ron with heart, and the H for heart, the E for energy, the A for attitude, R for resources, and the T for team. I just miss Ron so much. The two Rogers, words can't express how important they are to all of us. A big round for the two Rogers. The amount of energy and enthusiasm that comes from both of them is just exhausting, but it's awesome. It would the world just needs more of the two Rogers. And as Roger alluded to, Roger was treated on a window of opportunity trial that Dr. Susan Tsai did in collaboration with some prior mentors from MIT and Boston. And thank goodness Roger is here for all of us today, Roger and Jackie in that picture. So how do we keep hope alive in the arena? And as I mentioned, my comments tonight are largely around hope. You've already heard the science of things. Well, I really divided into three little circles. Treatment plan and the treatment team, which you heard a lot about from Erkut and Dan. The support team, which all of you have in your family and friends and the people who love you. And then great care is important to be given even when it's difficult. And I think for all of you who are patients and family members here, you have been through great care when it's been really hard to deal with. And for those of us who are doctors, I think we learn from all of you, and we also learn from personal experiences. And we become better doctors when challenge and tragedy affects us. And in my life, the first big tragedy was the death of my mother-in-law from glioblastoma. Lived with us for the entire 11 months of her diagnosis. Really an incredible woman. My best friend from Houston, who was also my neighbor, Ken First, who after I had already moved to Milwaukee, Ken called me one afternoon and said, you know, I had a CT scan and there's a mass on my pancreas. So Ken flew to Milwaukee. I think both Susan and Kathleen probably did his laparoscopy with me. And unfortunately, he had advanced pancreas cancer. And Ken was staying in our house. And you can imagine Ken and I up that night till about 5, 6 a.m. We definitely watched the sunrise, talking about a lot of things. Our grandson, Grady, who needed heart surgery at 4 months of age, and our other grandson, Hudson, who came into the world a little bit early. I think all of these experiences have made me a better doctor, and I think make all of the doctors in the room a better doctor. Kathy and Randy Dean, who I highlighted last year in Arizona, just an amazing woman. I think Kathy's life was as long as it was because really great people at every single level of healthcare, from nurses to technicians to our amazing residents, fellows, and some of us who were older, put an incredible amount of hard work into her care. Unfortunately, Kathy's no longer here. I don't know if Randy's here tonight, but Randy, just an amazing guy. I wanted to also talk about one of the other patients I highlighted last year in Arizona, Lee Harry, and give you an update of her. And I think I have a little video. You can see that Lee, like many of our patients, had a long period of chemotherapy, radiation. Her surgery was now a little over 1.5 years ago. And I wanted to give you an update of her and also show you a little bit about the amazing medical center that we work at. And this is Lee's story with a little bit of an update.
We are at Froedtert in Milwaukee, Wisconsin, and Maddie and I are very excited because we've been awaiting this day for a long time. I am going to have a complete pancreectomy today with Dr. Douglas Evans and his amazing team of doctors.
She's handled it so courageously and gracefully. It's been kind of a long road, and I've just been so proud of her because she's just been so strong.
We're just ready for the next step and ready to get better and start healing. I love you, Natalie.
So we're starting early in the morning because this is going to take a little while. I imagine if everything goes perfectly, we're probably looking at 7-8 hours of surgery. She's a complicated patient from a cancer perspective. She's had a huge amount of chemotherapy and radiation because of a fairly large, what we would classify as a locally advanced pancreas cancer. She's done extremely well. Her tumor markers have normalized. Her tumor looks better on imaging. And hopefully we're going to be able to take this out today. When a big operation like this and the patients had so much radiation and chemotherapy, to check margins on what we send to pathology is almost impossible. So I send margins from the periphery of the tumor. A couple of them did come back positive. So we've re-excised this. We've set a couple Hail Marys, and hopefully the nerve further away from the tumor will be negative. I think this was one of the highest levels of difficulty, and I think the operation overall went great. Our final margins at the periphery of the tumor were all negative. Really couldn't have gone better. All the areas of concern with regard to the nerve around the arteries were all taken out really nicely. She's waking up now. She'll go to the recovery room for 2 hours or so and then to the floor. We're very fortunate to be back now about 20 months later and to give all of you an update. We followed you and your daughter Maddie through that operation.
This is just a couple weeks ago.
And then the cancer came back in your lungs. How are things going for you right now?
Things are going very well. I'm able to walk every day a couple miles with my daughter, usually in the woods, which is good spiritually and physically. And then we're taking a yoga class once a week. So I've been feeling really good. Last summer was rough, but this summer I just have maybe the day after chemo I'm okay, and then the next day I'm kind of not feeling the greatest.
And we're starting to gain a little weight.
Yes.
Something that probably 30 years ago you never thought would be a problem. Probably keeping the weight off would be more of a problem. Rather than,
I never thought I'd be working to gain weight.
Maddie, from your perspective, what do you think has been the key to your mom's incredible strength and resilience, and she's just so strong?
She has her own inner strength personally, but I think also having the support of good caregivers,
a loving daughter
here at the hospital, family members,
excellent doctors,
and then just doing things that make you feel well.
For those of us who spend our entire lives in the pancreas cancer world, we realize how important it is to have that mind-body connection.
I think just the good love of a family, prayer,
honoring your body and where you're at day by day.
Yeah.
I think, too.
And just having good doctors that believe in you and listen to you. And
Lee, Harry, and Maddie, thank you so much, and please know we're on your team forever.
Thanks, okay. Dr. Evans. Okay.
Yeah. Incredibly strong lady, like all of you. And I don't know if Haley Hendricks is here, but Haley in our Department of Surgery has helped me with the next few videos. Haley's just amazing. So this is entitled here, Always Thinking of Others, and in the arena himself, an incredible man who's not only a patient but also a physician. You can see the diagnosis in April of 21, and you can read that here. So, whoop, I think I went back. Okay, there we go. So this is Iko Hirano, who's just
Hello.
an amazing
My
man.
name is Dr. Iko Hirano, and I'm a practicing gastroenterologist for almost 3 decades. I am speaking today, however, not in my role as a physician caring for patients with digestive disease, but as a patient diagnosed with pancreatic cancer in January 2023. I want to share with you 5 lessons from my own Silver Linings playbook. The first lesson is to listen to your spouse, your family, and your friends, those who know and love you. These individuals are your fellowship of the ring, standing in your corner on your quest against a very formidable opponent. The second lesson is to seek out the best medical team. I personally reached out to colleagues and friends and concluded that the team at Medical College of Wisconsin, led by my surgeon, Dr. Doug Evans, and by my oncologist, Dr. Mary Mulcahy at Northwestern, was the right choice for me. I find it perfectly fitting that Dr. Evans is not only one of the most respected pancreatic surgeons in the world, but also an accomplished sailor. I cannot imagine a better captain for my journey. The team has included Dr. Beth Erickson at MCW and several gastroenterologists, nurse practitioners, dietitians, nurses, and support staff who have been absolutely wonderful. One of the most disconcerting lessons I've learned about pancreatic cancer is that there is not a uniform approach to treatment. This variability in care, including choice and duration of chemotherapy, timing of surgery, and the use of radiation, can be overwhelming. My advice here is to be your own best advocate. Be stubborn and even annoying when necessary, until you are comfortable that the treatment plan is the best approach for you. The fourth lesson is to remain positive. This is admittedly quite challenging when confronting one of the deadliest cancers. The friend, the colleague, the family member who goes out of their way to lift your spirits, bring you a meal, run errands, or comfort you. The same way that food always tastes better when you're hungry, my awareness of my pancreatic cancer diagnosis has allowed me to more fully appreciate these moments of light. The fifth and final lesson is to be kind to yourself and open to compassion of others. Many of you have been on personal journeys with pancreatic cancer for far longer than I have, and this has been inspirational to me. I have found guardian angels not only in my healthcare team, in my family and friends, but also in people who have met along my journey, including several patients with pancreatic cancer. I am grateful for this opportunity to share these words with you, and wanted to particularly thank my wife for being my steadfast partner and inspirational compass on my journey. Thank you.
So unfortunately, on the day of his operation, we found that things were a little bit more advanced. Fortunately, another physician/patient happened to be in Milwaukee at the time, Michael Gordon. Michael, where's Michael? Can you raise your hand there? Yeah, Michael, needless to say, you're the guardian angel for Dr. Hirano, and you've guided him through this. Just an amazing lesson on how important friendship is, even when family is incredibly strong. Dr. Hirano has had an incredible team of physicians going over his case and has actually already been started on a really novel therapy due to some great work by Dr. Kamgar. Where's Mandana? Can you raise your hand? Mandana Kamgar, who works here along with a host of other doctors. So thank you. And then I wanted to show you this video. This is a patient who we just operated on recently, just to show you and you've seen with Lee Harry's operation, you saw everything that goes into the operating room. Obviously, I think we have the most amazing facilities in the world at Froedtert Hospital. But just look at the operating room and the number of people that are involved in a patient's operation. And then towards the end, I give a little shout out for a new program we started called Pancreas School to try to educate patients before they have large operations. So Mr. DeGamo is doing well, and I actually saw he and his wife today when I swung by the outpatient clinic. Incredibly strong guy. I may have to hit this again. Yeah, there we go.
My name is Richard DeGarmo. I'm from the south side of Chicago in a small town called Oak Lawn. And I was diagnosed initially with pancreatic cancer back in September of 2022. We did the first 4 rounds of chemo down at the University of Chicago. After my 4th round, I returned to Froedtert to receive a scan to see how everything was going. And that's when Dr. Evans first told us that, you know, the size of the tumor was responding favorably.
It worked out beautifully.
Worked out,
yeah.
So we continued with a 2nd round of chemo, and then after that, I was prescribed for 30 days continuous of radiation treatment here at Froedtert Hospital. Dr. Evans felt it was the right time to go ahead and do the Whipple procedure. I believe I was 20% chance based on the size of the tumor at the time when Dr. Evans first saw me of being here today. I mean, I'm here, so I made it this far. So that's something.
So Mr. DeGamo is an incredibly courageous man who has been through a lengthy course of chemotherapy followed by radiation. Fortunately, he's had a dramatic response. His tumor is quite a bit smaller than it was at the beginning, and everything looks quite favorable. He's responded beautifully to his treatment, and hopefully we can take this tumor out. He will require some blood vessels to be moved around and replaced, but that's something we've worked on here over the last couple of decades and really perfected. Everything went really well with the surgery. All of the frozen sections were normal with no evidence of cancer at the periphery of the tumor. He looks great in the recovery room. He'll spend probably a little less than 2 hours in the recovery room before he goes to the floor. Well, I wanted to give a brief review of the anatomy of the operation we just did. And it's also a procedure that we first described here at the Medical College of Wisconsin. We're going to put the liver up here. Down here are the intestines. Liver also has an arterial supply. The aorta from the heart comes down and then gives off a blood vessel, which then comes up and also supplies the liver that way. We have another blood vessel that goes to the spleen and another blood vessel that goes to the stomach. So the pancreas sits right on top of all this. So this is how the pancreas sits. The spleen is over here, and you can see the obvious problem then with this. In this patient's situation, the tumor was essentially right there. And it caused a significant narrowing of these blood vessels. In essence, to take this tumor out, we would have to remove this segment, this venous system. So I'm going to draw the veins here. And this is our liver up here. So the portal vein, the superior mesenteric vein, and here is the splenic vein. Okay, and we have to take this segment out. So what we described a number of years ago was the kidney sits over here, and it drains into the inferior vena cava, which goes back to the heart, just like that. So what we did in this patient is we took the splenic vein, and we just brought it right down into the renal vein, and we sewed it in right there. So it drained beautifully. And then we removed this segment of vein right here, because the segment that we removed was too long to simply bring this end up to that end. And because this is the venous system, and it doesn't have a large pressure head like you have in your arteries, we can't really use artificial material in here because it will tend to clot. So we need to use a vein from another part of the body, and it just so happens that the left internal jugular vein in the neck is a perfect size match, so we sewed that in, and that's how we reconnected everything in this patient.
I'm still a little sore, but that's expected with the major surgery that I had. But overall, I feel pretty good about leaving. A little anxious about the next chapter, as far as my dietary restrictions and diabetes. But overall, I think I'm in pretty good shape. I've got a good support thing, and that's the one thing I would stress to anybody. I was blessed to have my wife here, and whenever there was anybody here.
So Mr. DeGarmo is a little bit too early, just having done his surgery recently, for him to make it tonight. But I think, what he echoed, the importance of all the support for him is just so critical. And if anyone wants to learn more about all the drawings and the surgery stuff, just Google Pancreas School or go to YouTube, and it'll be right there. As Dan and Urquhart both mentioned, one of the many powers of the Sina Magowitz Foundation is supporting clinical trials. For those of you in the room who aren't patients of today, that means that you're probably going to be a patient of tomorrow. And the hope for you is through clinical trials and advances in medicine. And this is the one that both Dan and Urquhart mentioned, really the brainchild of Susan and Jen, and is open both in Arizona and here in Milwaukee. I don't know if Carol Rubat is here, but Carol, love you. And Carol's been through a ton. And Carol, you'll have to tell everyone afterwards the Bombas story. I can't remember it other than, everyone in my office said, I love those socks. Can we get some of those socks? I know I have a bunch of extra Bombas because of you, but Carol's one of many patients that we have videos on. I know that Roger mentioned yesterday that he would love to add more patient stories to the Sina Magowitz website. I would love to add more patient videos to our Department of Surgery website. So if any of you are interested and you don't mind coming to the medical center one more time, please let me know. A little shout out for Pancreas School, and Kathleen, Mandana, Bill, you're up for more editions of Pancreas School. Urquhart said he was going to do one as well, so we're going to hold you to that. And all I can do is say thank you, Roger, and your entire staff. When all of us dream about doing something, absolutely. When all of us dream about doing something, we're excited a little bit. But the difference with Roger Mankiewicz and Roger Kapliger is when they dream about something, they actually do it, which is just amazing. And we're forever grateful to both of you. And I'll leave you with a great quote from a song that I love from Kenny Chesney. And thank you all for coming tonight, and thank you all for your kind attention.